Good afternoon. I am Dr. Samantha Benjamin Allen, and I welcome you to this webinar on the power of mobility and quality of life. So our objectives today are one, to introduce you to me and my practice, which is Freedom Wellness Physiatry, as well as teach you why mobility is important. We'll learn the significance of a physiatrist or a physician of physical medicine and rehab in leading a team to approach a rehabilitation program and discuss the benefits of joining the Freedom Wellness Physiatry experience. And we'll open up for Q&A at the end if anyone has any questions. You'll have to forgive my voice. I'm getting over this virus that's been going around. So sometimes my voice cuts out, but I'm going to try my best. So I'll tell you a little bit about myself. I, again, am Dr. Samantha Benjamin Allen. I'm board certified in physical medicine and rehabilitation. I've been practicing for 10 years, and I am the founder of Freedom Wellness Physiatry. I'm originally from the DMV area. I grew up in Prince George's County and was born in DC to hardworking Jamaican immigrants who came here in the late 1960s, early 1970s during the Civil Rights Movement. I went to Penn State University for my undergraduate degree in biobehavioral health with a concentration of Spanish, in which I studied abroad in Mexico. And I also have a minor in business from Penn State. And I got my medical degree from the Philadelphia College of Osteopathic Medicine. I enrolled in the dual degree program there and completed my master's in business while studying medicine, and went on to do my internship in family medicine at South Nassau Communities Hospital in Oceanside, New York, and finally did my residency in physical medicine and rehabilitation at Sinai Hospital, Baltimore. I do have a background in physical training, personal training, as well as working in the inpatient and outpatient settings to help optimize outcomes in patients undergoing rehab after various illnesses, whether it be neuromuscular disease or a trauma, spinal cord injury, brain injury, strokes, or just debility from chronic illness after heart surgery or joint replacements. My interests include conservative management of neck and back pain, osteopathic manipulative treatment, spasticity management, stroke and brain injury recovery, and musculoskeletal medicine, including trigger point and peripheral joint injections. And a little bit about my personal life. I am married. I have 2 children who are 4 and 2 years old. And I enjoy traveling and spending time with my beautiful family, my husband, running, fitness and nutrition, as well as well-being, community service, mission work, and mentoring. Freedom Wellness Physiatry was inspired. Actually, in high school, I wanted to open my own practice. I've always had a dream of doing that, but I didn't have a clear vision on what it would look like to start. And the catalyst for this launching came from a variety of experiences where I noticed there was a gap in healthcare, especially to the elderly and those who were severely debilitated and at home or coming out of hospitalizations where they left 10 times worse than they came. They might have went in for something small, ended up with an infection or some complication, had a prolonged hospitalization, left the hospital, sometimes weren't even able to go back home, got in a nursing home, continued to decline from there. And in some ways, this led to an untimely death or them never really living up to the potential that they could have had they had the proper rehabilitation experience after that hospitalization. And what really made it hit home and confirm that this is a need in the community is one of my close friends' grandmother, who was completely independent, had a fall and unfortunately fractured her ankle. And she went to the hospital. She was also found to have a urinary tract infection and high blood sugar. Those things were treated. They put her in a boot for her ankle fracture because she was very elderly. They thought doing surgery might have been more risky, so they allowed it to heal by placing the boot on her lower extremity. And because she didn't have the support at home to help her manage her daily needs while the ankle was healing, she was sent to a nursing facility. And unfortunately, there was immobile, wasn't really getting the proper attention. She ended up with a stage 4 ulcer, which is a pressure wound that goes deep enough to penetrate the bone tissue. And she ended up with infection and complication after complication. Eventually ended up to a point where she was unable to do anything for herself. She was completely dependent to eat, to dress, to turn. She became nonverbal to the point of simply moaning in pain. And she ended up with an NG tube because she was no longer eating. So my friend's family decided to take her out of that nursing home because they were leaving her for dead and basically said, just put her on hospice. I don't think there's anything much we can do at this point. And they, being the loyal family members and, you know, caretakers, they took on that reign and said, you know, we're going to take her and we'll figure out the rest later. They ordered a hospital bed and some of the equipment they needed to tend to her wounds. And they called me and they said, we don't really know what to do at this point, but we know she can do better. We know her potential. We know what she was before she had this ankle fracture. And we want her to get the best treatment and chance at recovering as possible. So I went there, I examined her, I did a full assessment, I got the history, we went over the story of all the events that happened, you know, leading up to this point, and I gave them a list of instruction and recommendations to perform with her daily to help her achieve improved function and health. Because basically, she also lost a lot of motivation and her morale was severely decreased from the experience that she had at that facility. And would you believe she got to a point where she was talking again? She was making her needs known. She started to eat. She was able to sit up with minimal assistance. Mind you, she was completely dependent for everything. You know, she was not following commands. Now she was moving her limbs on command and making her needs known. So this was a major change for her and significant improvement in her quality of life. And that is what hit the nail on the head. And I said, you know what? There is a gap in the system, and we can provide better access and we can go into the homes of patients who are so debilitated that they can't get to an appointment. Trying to get them up to an appointment is a very painful and, you know, arduous process. Let's come to them and offer our recommendations. They have the right support. Change can happen and the outcome can be much better than it would have been had they stayed in a hospital or went to a nursing facility. And they have family there who wants to help. So that's a little background on Freedom Wellness Physiatry. You can see our vision and our mission here on the slides. I'm not going to read it, but we serve adults in the DC metro area. And house calls are within 30-mile radius of Fort Washington, which is where we are based. Exceptions can be made on a case-by-case basis. So anyone who's interested can always call. We can discuss that. So if you can think of anyone who might be able to benefit from something like this, I invite you to share the information at the end of this presentation with them. So why does this population matter so much? Already the middle-aged outnumbered children, and we'll reach a new milestone in 2034 that older adults will edge out children in population size. So people aged 65 and over are expected to number 77 million, while children under 18 will number 76 million. So the elderly will actually outgrow the population of children in the upcoming years. And they unfortunately have suffered from a lot of neglect in the healthcare setting. So why is mobility so important? An elderly patient typically spends 83% of time hospitalized, lying on their back. In an article by Brown and colleagues, they attached wireless accelerometers to hospitalized seniors and found that they spent just 3% of their time standing or walking, only 3% of their time standing or walking. Otherwise, they're laying in bed. Bed rest in and of itself is associated with numerous adverse outcomes, many of which we are trying to prevent, like pressure ulcers, DVTs or blood clots, and functional decline. Hospitalized seniors lose up to 5% of their muscle strength daily, and immobile seniors are 6 times more likely to be discharged to a long-term care facility and 34% or 34 times more likely to die in the hospital. In one study covering thousands of patients, 35% of hospitalized elderly patients were discharged with a hospitalization-associated disability, meaning that they developed the disability as a result of their hospitalization. And within a year, 41% of them died, and only 30% were at baseline function. 30% were able to get back to their level of function that they had before they're in the hospital. So seniors suffer when they go to the hospital, and many of them never regain the function that they had before they went in. And many of them don't get rehab when they leave, and that can make a significant difference in their outcomes. Just like the lady I mentioned to you who was completely dependent, not even eating on her own. And we were able to get her to a place where she could do that again. And that is so important in quality of life. Strength can decrease 20 to 30% in just 1 week of bed rest, and 5 to 10% of muscle mass is lost in 1 week. 5 weeks of total inactivity costs 50% of the previous muscle strength. And this is amazing, guys. 1 contraction a day at just 50% of your maximal strength is enough to prevent this decrease. So this is very important. If you have any friends, family members, or even you are hospitalized, please know how important mobility is to getting you back to yourself, to your recovery, to your ability to recover more quickly from your illness. It is so important. So I'm telling you this so that you know, and you can advocate for anybody who's in the hospital, and even yourself. Get me out of bed, get me out of bed. Scream it from the mountaintops. Lack of stress and tension on bone through weight bearing and muscle causes osteopenia. Osteopenia is a precursor to osteoporosis, which means decreased bone mineral density. So it leads to weak bones that crumble easily, break easily, fracture easily. So we need tension and stress on our bones daily to help prevent osteoporosis and osteopenia from ensuing. So if you are laying in bed, hospitalized, or in a facility and they're not moving you and you're not using your muscles, it's still detrimental. Here are some detrimental effects of immobility. Bone loss, beginning 5 to 6 days after immobilization, and by week 2, it peaks. But with resuming activity, normal values in calcium are achieved in 6 weeks. Redistribution of body fluids leads to postural hypotension, meaning low blood pressure because the fluid pools and not enough is getting to your brain. So then when you finally do get upright or somebody tries to sit you up, the blood pressure drops suddenly and you're not able to sustain an upright position. And this is another thing that leads to people being bedridden because they weren't moving. And when they finally decide to, somebody, decides to move them or they get to participate in some type of rehab, because they haven't moved for so long, their body has to re-acclimatize to moving again. And then this causes increased sympathetic activity, rapid heartbeat, sweating, cold sweats, decreased cardiovascular efficiency, meaning the way the heart pumps becomes less efficient. Your heart rate increases. The faster your heart is beating, the less effective a pump it becomes. And the ability to pump out that blood and get it to all of those organs is weakened because it's beating rapidly, but it's not efficient. That's what's meant by stroke volume decrease, which may reach 15% with 2 weeks of bed rest. And in my example of that patient I told you about, within 6 weeks, she was eating again and sitting up. So, this is tested and proven. You also get a decrease in your maximal oxygen extraction by as early as 3 to 5 days of bed rest. Decreased pulmonary function leads to improved secretion clearance, so your cough becomes less effective. You can't get the mucus out. Decreased ventilation, leading to pneumonia. Decreased lung capacity. Decreased GI motility, meaning your ability to digest becomes impaired, leading to constipation and loss of appetite. Urinary stasis, meaning your urinary system doesn't flow well, doesn't filter well. Then you have increased risk for urinary tract infections. Skin atrophy ensues because you're not moving and offloading the pressure from different pressure dependent areas like your buttocks, the back of your head, the back of your shoulders, your shoulder blades, your heels. Skin atrophy develops, the skin breaks down, wounds ensue, then you develop pressure ulcers. So, what's the significance of having a physical medicine and rehabilitation physician leading the team approach to rehabilitation? There is something called acute rehabilitation, which is in hospital-based rehabilitation after a hospitalization, a trauma, injury, or surgery that is offered at certain facilities. But many patients don't get to benefit from this, either because they don't have coverage from their insurance, or they are not deemed appropriate because they are so debilitated, they don't believe the patient can endure the intensity of the therapy. So they either get sent home or to a nursing facility if they don't have any support at home to supervise them. And this leads to continuing debility, dysfunction, and poor health outcomes. So what if we brought a physical medicine and rehabilitation physician to the home setting for these patients who could not get acute rehab, or these patients who would otherwise end up in a nursing facility, but do have family who wants to help and is interested in supporting them, but doesn't know how? A physical medicine rehab physician or physiatrist has a goal of restoring function and mobility to those suffering from disability or physical impairment. And we often work closely with physical, occupational, speech therapists, nurses, psychologists, and other providers to help optimize health outcomes in a more efficient and holistic manner. Just to give you an example of how relevant or significant having a physiatrist leading a rehab program is, among Medicare beneficiaries eligible for post-acute care at home or a skilled nursing facility, discharge to home with home health was associated with higher rates of readmission. So even though they're discharged to home and they get home health, meaning they might have a nurse come in a couple times a week, they might get home therapy, physical therapy, occupational therapy, speech therapy, it's still associated with a higher rate of readmission. And I believe the difference is that there is no physician-led approach to their rehab program. So a lot of times, what I've even seen is therapists come and say, we don't really have much to do. We'll discharge you after 3 sessions. And if there's no advocate there or anybody who understands the process and the potential that a patient has, a lot of times there's a disservice and people don't get the amount of therapy or the intensity of therapy that they really need to get to where they can become more functional again. And I've seen it make a difference when somebody who knows, what's going on and how to direct that care makes in the outcomes. Now, outside hospital setting, multidisciplinary rehab leads to improved mobility in older patients 3 months after their discharge from the hospital following acute illness, and it's not associated with lower risk of unplanned hospital readmission. Again, the difference is having a physician-led team. That is what an acute rehab program offers in the hospital, and those patients do much better. So I'm simply helping to bridge that gap and offer that to those at home. Again, On a 6-minute walking distance test, patients receiving rehabilitation walked an average of 23 meters more than the controls. And hospital at home programs that enable patients to receive acute care at home have proven effective in reducing complications while cutting the cost of care by 30% or more. So I want to leave you with a wellness prescription of your own, because I want you to have something that you can take from this, that even if you don't feel you personally could use these services, you're taking something with you afterwards that can help you to live a more well-balanced, healthy, and whole life. We should be drinking 2 liters of water a day. Sounds like a lot, not easy for many to do, but if you get a water bottle that has measurements on it, 2 liters is 2,000 mLs. And usually a water bottle has a line on it for measurement, so you know how much you're drinking. So I recommend you get a water bottle like this or bigger that you can use to measure how much water you're taking in a day. So for instance, if you have a 24-ounce water bottle, you probably want to do at least 4 of those a day. 1.5 to 2 liters is fine. Now, if you have any illnesses that prohibit the amount of water you should have, like chronic heart failure, you need to talk to your physician about this. So any recommendation I'm giving here, please clear it with your physician before you take it on. As I am a physician, I'm not your physician, so you want to make sure you clear that with them. You should be getting 7 to 9 hours of sleep a day. You want to nourish your whole being with rest. And rest is not just sleep. There's spiritual, creative, mental, emotional, social, and physical rest. And this was inspired by Dr. Dalton Smith, who is an internal medicine physician who really delves into the importance of rest in our well-being. Spiritual rest being spending time in meditation, in the presence of God or Creator or the God of your understanding, whatever your spiritual preference is. Creative rest includes things like painting or drawing or going out in nature and just enjoying the beauty of creation, the stillness of a pond, the flow of a river, listening to the birds, getting out in nature. Mental rest, that is doing something that helps to take your mind off of whatever stressors you have on a day-to-day basis. Some people like to watch comedy, or they'll do something just to, what they say, quote unquote, mindless, to just give their mind a break, especially when they're overwhelmed and there's just too much going on. Emotional rest includes calming your senses. We have 5 senses, you know, but they can be affected by what we're letting in. So what we're listening to, the media, music, you know, the newspaper, what we're reading, they're all affecting our senses. And sometimes we can have sensory overload. So it's important to minimize the time or set a limit on the time and the amount of, you know, influence you're getting from media. There's a lot of negativity out there, and you want to bring more positivity into your space. Social rest touches on the interactions we have with people. So all of us know maybe 1 or 2 people who tend to drain us emotionally. You leave an encounter with them and you just wonder, why do I feel so drained every time I talk to them? You want to dose your time with those people. So some people, in the contrary, seem to bring you life. And when you are around them, they just seem to pour more into you than they take away. So you want to take time to encourage and enhance those relationships, not neglect them. But, you know, some people that tend to drain us, not to say you should neglect them, but you need to dose your time with them so you're not overloading yourself with that type of energy. And physical rest can be both passive, like sleep, or active, like stretching or yoga or dance. So those are just some examples. We can go much more in depth with that, but I just wanted to leave that with you. Eating a good diet, a balanced diet. You want 2 to 3 servings of fresh fruit and 2 to 3 servings of vegetables a day. Now, It's easier said than done, but if you have a fruit in the morning, take one with you to work, and one in the evening, you can do that. Make your snacks for lunch. Cut up some carrots or celery, grape tomatoes, things that you can just kind of pop in your mouth and snack on throughout the day. You can use dips or dressings to make it more palatable if that's difficult for you. But it's very important to get more of those in as we, in Eastern society or Western society, I should say, tend to pack on the processed foods and the fast foods, which really don't give us much nutritional benefit. And you want to actively address areas of brokenness in your life. This goes again on the mental health aspects of our wellness. Grief, hurt, anxiety, trauma, depression, unresolved conflicts between you and family members or friends. These things weigh on us, may actually affect our health. They affect our blood pressure. Stress increases our cortisol and our ability to metabolize sugar, leading us to be more prone to diabetes. So you want to address actively broken areas in your life with prayer and counseling. So do not negate the value of having good counseling. Um, there's a stigma on, mental health and therapy, and there's nothing wrong with it. We're all given gifts and talents, and one gift is the gift of healing. And there are specialized providers who have a gift in dealing with mental health and are able to unlock things that we've suppressed and held in for our entire lives that actually are negatively affecting our ability to function and interact with others. So this is very important. So please address areas of brokenness in your life. And we're not meant to do it alone. We're not meant to be in a vacuum. It's important to talk about the things that we're dealing with. And if we can't do that with a friend or family member, a counselor is a perfect, non-biased, non-judgmental person who you can do that with. You want to avoid and minimize alcohol and caffeine. If you drink alcohol, you can cut it out. That'd be great. It is a neurotoxin and a central nervous depressant. So central nervous system is negatively affected by alcohol. So this impacts your blood pressure, it impacts your heart. So be mindful of that as well as caffeine. You want to minimize your use of that to 1 cup a day if you drink coffee or tea. Favor prepared meals over processed foods and eating fast food, as I mentioned earlier. And you want to exercise 45 minutes, 4 to 5 days per week at moderate intensity. Moderate intensity is calculated by doing 220 minus your age. That is a typo. It says 200. It should be 220 minus your age. That number would equal your maximal heart rate, but you don't want to work out at your maximal intensity because you pass out. You want to work out at 60 to 70%. That would be moderate intensity. So take 60 to 70% of whatever number you get when you do 220 minus your age. And that's your goal heart rate when you're doing a workout. So you put your 2 fingers at your carotid, use your clock or watch, check how many beats per minute you get. And if you achieve that 60 to 70% of your maximal heart rate, you're working out at moderate intensity. You want to take time to warm up, 10 minutes, cool down for 5 minutes after, and stretch to prevent injury. And you want to weigh in weekly to make sure you're maintaining a healthy weight or at least going in the right direction. Now that you've learned about Freedom Wellness Physiatry and a little bit about my background, I just want to let you know what some of the benefits of working with me in my practice would be. You would get direct access to a physical medicine and rehabilitation physician without having to wait for a referral from your primary care provider, which I know a lot of insurance is required. I do not take insurance, as I found insurance sometimes is a barrier to getting what you need. And, there are hindrances that I've noticed with insurance that prevent people from benefiting from the rehabilitation that they could even get. So I don't accept insurance, but when I write up my notes and give you written recommendations, I put all of the codes there. So if you want to submit the documentation to your insurance to see if they'll cover it, you may do that. But I do not accept insurance. So there are no hidden fees or any denials you have to worry about. But I encourage you to keep what you have if you have it, because whatever referrals I give, or if I write for equipment like a cane or walker or something like that, insurance will likely cover that. There are no long waits for appointments. Again, there's transparency, there's no hidden fees. You have extended time with your physician, so there won't be any rushing me doing my consultation with you and follow-ups. Usually, doctor's offices, you might get 15 minutes, 30 minutes if you're lucky. Usually, my visits are about an hour for initial consultations, and follow-ups are likely shorter, but just to give you an idea, sometimes they might be a little different depending on what the situation is. And you can access healthcare from anywhere. So I do offer telemedicine follow-ups. Initial consultation must be in person, but if you're unable for any reason, you can do a telemedicine follow-up appointment. You will benefit from personalized care and discounted pricing for membership. So, excuse me, I would have direct availability with you. And if you have any questions, you could always call me. I would interact with your providers. If there's any concern with conflict between medications that you're taking, or if you've had difficulty navigating the system to meet your needs, I help advocate for you in that regard. And prescriptions related to rehabilitation, I would write if necessary. And I offer osteopathic manipulative treatments, which is hands-on manipulative therapy for certain musculoskeletal ailments to help hasten your recovery. I also do consulting, including education for health agencies on how physiatrists can be a great asset in evaluating, assessing, planning, and implementing an individualized rehab program for their patients. So here's the pricing. You can join for a 6-month membership, which is just $12.24. That includes your initial consultation, treatment plan, written recommendations for your personal use, and up to 5 face-to-face follow-ups. 1-year membership is $21.99, and this includes initial consultation with up to 10 face-to-face follow-up visits. You can pay as you go. You would forfeit the package or membership discount. An initial consult is $400, face-to-face is $225, and telehealth virtual follow-up is $175. A monthly payment plan can be discussed on a case-by-case basis. Here's my website and email address if you have any further questions. And I look forward to working with you. Have a blessed day, and thank you for joining me. Till next time.